Hello everybody, welcome back to another video. I'm Joe, I'm a physical therapist here at Freedom Physical Therapy. Today I want to go through a very easy observational evaluation technique that I use a lot with any shoulder rehab. I think it's really important to look at this stuff, especially with any overhead athlete, because it gives us a ton of information when looking at the scapular position, just in a resting position, as well as when it starts to move. Gives us a lot of information before we really do any other technique or any evaluation. And this can be put in at any point during your evaluation technique, as well as people can look at it themselves. I tend to look at it at pretty much the very beginning because I think it gives us a ton of information based on the set position of the shoulder blade, looking at it with movement, as well as with muscle activation and just some of the different scapular positions. We call it scapular dyskinesis. And I'm going to go through what I look at and what it kind of tells us. So here we have a shoulder blade. For this sake of example, this is the right shoulder. So you have your humerus here, you have some of the ligaments that are holding the shoulder itself together. In this motion, this shoulder, head of the humerus doesn't move that much just because of the screws that are in here. But in real life, obviously your shoulder can move. We have our clavicle up here, and then we have the actual shoulder itself. So we have the spine of the scapula here, you got your medial scapular border, superior border, and then you got your inferior border here. So here we have, if you have muscles on top, you've got your supraspinatus that's on top, infraspinatus, teres minor, and then you've got your subscap underneath. All four of those muscles are critical to know where they are, what they do, and how they work with shoulder pain. So that's basic anatomy, basic things that we go through as physical therapists, knowing where those muscles are, and I tell patients where it is all the time when we're going through this. So with the scapula itself, I see a lot of throwers, a lot of overhead athletes, or people that have general shoulder pain in general. So I look at this a lot, and I think it tells us a lot of information. So in this position, what I look at, if we're resting here, I see a lot of type 2 scapular dyskinesis, which means the scapular border on the medial side, you basically can get your hand underneath it and you can see it sticking out. You also have type 1, where this inferior angle sticks out a little bit, so you'll see it tipped forward in a sense of the actual relative position of the scapula. See the whole thing tipped forward, which means that this back side is tipped up. Or the top side, you'll see a backward rotation of the entire scapula, which means that the superior border is more pronounced. Again, all these positions based on the scapula tells us what's going on. If I see weakness here, or this is more pronounced, that tells me the serratus anterior is a little bit weaker. If I see more weakness down here, we probably have a low trap issue, which we need to work on getting that shoulder blade back. And if you see it top side, you see this more pronounced, we're probably weaker up top or tighter up top, which is causing this to come back. All of this in relation is really important to know what's going on because it gives us a ton of information right off the bat. It helps me as a provider get more information to tell the patient this is what's going on and this is what we're going to do about it. So next I'm going to show you what it actually looks like on a human being. Again, just to give more information on what the scapular position can tell us. So we'll show you that next. Welcome back everybody. As you can see, different wardrobe on today. It took a couple days in between of filming the first video, talking about the shoulder blade and actually finding time with a patient as well. So we have Aaron, who's one of our aides here at Fox Point. He's actually in physical therapy school right now. So in the future, very shortly, he's going to be doing what I'm doing. And we're going to be looking at his shoulder blade a little bit here. Little backstory on Aaron. He had a shoulder surgery last year that I actually helped rehab him for. And it's actually on this right shoulder. So we've worked a lot on his shoulder blade, and this presentation is actually better. It would be a better example if we had him right after his original surgery, but he still is a super good candidate to actually look at his shoulder blade itself. So if we remember from the first video, we've got the medial border of the scapula, which you can see on Aaron through his skin. You can see the inferior angle. His spine of his scapula is up top up here. Up top, he's actually really good. He's pretty built up here. Most people I see are actually pretty good up top. But for Aaron, and he's got fair skin as well, which really helps with this. You can see where I've already kind of traced my finger as I'm talking to the camera right now, where he's getting super red on that medial border, and you can see it pretty pronounced on this right side versus the left. Actually, left side, he's pretty good. Now, Aaron's right-handed, so he does more with his right hand, so typically I see a little more presentation on the dominant side. Why that is, I think it's hard to say, but just because I work on the dominant side, right-handed throwers, right-handed writers, or just right-handed dominant people, you're going to use that side more, so we see a little more presentation. So with Aaron, I would say that we've got type 2 scapular dyskinesis on this right side, as well as type 1. So with Aaron, what I'm doing is I'm just kind of feeling for that side of the scapula. With him right here, I can definitely get underneath it. And from here, sometimes we can even do a sub-scap release and just get underneath, which isn't the most comfortable. I wouldn't do it in the seated position. I do it where he's prone, where I can really use gravity to help me out. But for Aaron, we've got type 1 on the angle here. We could argue that that's there. We could also argue that there's type 2. And what I would say is type 1 and type 2 greater on the right side versus on the left. So in order to improve these weaknesses, type 2, I would say we've got to improve your serratus anterior. And from there, I have a program of exercises based on your skill level to input to make sure that we address this limitation. And then type 1, and Aaron will nod his head because we've done this a lot with low trap activation, both prone and standing, just to increase the activation of this low trap on the bottom part of the scapula. So compared to the model, what I just showed earlier versus what we have now in an actual human body, you actually see the presentation just like you would on the model. If anybody has any questions or feels like they have any shoulder blade dysfunction or shoulder blade pain, definitely come see us here at Freedom Physical Therapy in Fox Point. Thanks for watching.